Hey everybody, welcome back to another Facebook Live question and answer. We're coming to you both from Tel Aviv in New York, and it's a tremendous honor today to have Dr. Daniel Barone, Associate Medical Director of the Sleep Center at Cornell Medical Center in New York, taking time away from his busy schedule and right in the thick of things in New York City with the whole coronavirus epidemic. Um, we want to hear from you guys, whoever's out there. Tell us where you're from. Feel free to ask questions. We'll try to get to them and learn as much as we can today. Again, we're also learning from you. So the more you contribute, the more we can learn. It's really an honor to have you. I've learned from you and trained from you. Dana Barone is a leading sleep expert in the United States and abroad. He just wrote a book, Let's Talk About Sleep, available on Amazon. If actually, if you can show the book, we'd love to see it.
Yes. Thank you, Roni. Thank you,
One
folks.
of the best tools to fall asleep, I recommend it to all of my patients. Works much better than Ambien. So all of you out there who are looking for a good
Thank you,
sleep
my
tool,
friend. A great plug.
how are you doing now? I know it's a really difficult time in New York.
Yeah, it's I think across the board everybody is feeling this in one way or another. I mean, I was on standby to help out in the ER. It was kind of an all hands on deck type of situation, but fortunately we had enough folks, so I've been basically just doing telemedicine, seeing my patients kind of the way we're doing right now, and trying to help out in a small way, if I can.
Are you seeing a big increase in people having difficulty sleeping, insomnia, trouble falling asleep?
It depends, actually. Believe it or not, I've some of my colleagues say yes, some say no. I found it to be about half and half. I found some of my patients, I think, because they're not commuting, they don't have the same pressures as far as going into an office. Some of them are actually sleeping better, whereas others, are just focused on the news and whatever else. And I think that's making them have worse insomnia. So it's half and half, I would say.
I'll tell you, as neurologists, we write more cannabis than most other experts. And actually,
Right.
most of the conditions for medical marijuana approved in New York are neurological conditions.
Mm-hmm.
Of note, sleep is not one of them. And
That's
interestingly
right.
enough, a lot of my patients that are taking cannabis, it's the one thing that actually helps them the most. Relaxing, sleeping, get a good night's sleep. What do you think about it? Is cannabis good for sleep?
Well, it's an interesting situation. So the first caveat I'll say about this, and I know you know this, is we don't know a lot about how it affects the brain, really on a short term and a long term basis, right? So short term, you use it for headaches, for pains. I mean, it's actually one of the strongest anticonvulsants that we have, believe it or not. When it comes to sleep, it's interesting because if it does work, I have found, and anecdotally, is that it does relax the patient's brain a bit, right? So if there is some underlying anxiety or subclinical anxiety or depression or so, it may help offset that. The problem, though, is that marijuana, when you use it chronically in any form, it actually is a REM inhibitor, right? So it inhibits REM sleep. People getting chronically a low amount of REM sleep. The reason, I would say the proof of that is if somebody smokes marijuana chronically and then stops, what's the first thing I'll tell you is that the nightmares come on full force and they have these crazy dreams and whatnot. The reason being is because up to that point you had been suppressing the REM sleep, and then now it's trying to come on full force and they get REM rebound, and that's where a lot of the crazy dreams and whatnot come on to play. So long term, if somebody is chronically REM suppressed or REM deprived, what are the consequences of that? We don't know. But is that balanced against, well, if they don't use this, they're not going to sleep at all? Then it becomes a question where we say, we don't really know the long term effect.
Yeah. You're a very big advocate for sleep hygiene and actually getting your life in order, organizing your day, and trying to make sure that everything is right in the environment to get good sleep. It's kind
That's
of
right.
against the current of what people do now. I mean, you can just take an Ambien for 10 milligrams or take a Valium and you're asleep in 20 minutes
Right.
without doing anything. What do you
Right.
tell to people that just want to take a pill and get sleep?
Yeah, I mean, it goes along with what I just said about any form of marijuana. It's yes, these things can help in the short term, but what are the long term consequences? Actually, if we want to talk about the benzodiazepine medications, Valium, Klonopin, Xanax, they also inhibit REM sleep. Ambien has been linked as these other medications have with dementia down the road. even early death, believe it or not. Again, so we're not really sure what the long-term consequences of these things are. And what I always tell my patients is, look, if you haven't tried anything yet, the first step would be to improve your sleep habits and maybe try a naturopathic concoction such as melatonin. I'm a big believer in melatonin, sometimes valerian. But I think if you do that in conjunction with good sleep habits, that will not cure the problem, but it'll definitely help to some degree. When we're left with more hardcore cases, then we have to just use a risk-benefit profile, and that's where medications come into play.
And when people are taking cannabis to sleep and they're telling you that they're getting a great night's sleep, despite the fact that they have other problems going on, they're using their phones before bedtime, pressing like on Facebook, watching
Right.
Facebook Live at 1 a.m. in Tel Aviv.
Right.
But they're saying that they're waking up refreshed and they have a lot more energy. They have a lot less pain.
Yeah.
I have lots of patients that suffer from fibromyalgia. A little bit of
Yeah.
cannabis allows them to finally get good rest.
Sure.
Would you recommend they continue doing it?
In that case, I can't. I mean, I would tell them what I just told you, as far as, we don't know the long-term consequences and how that could, down the road, how is it going to affect the brain long-term? Because we just don't know the answer to that. What I would say, though, is I would rather my patients sleep than not. So if it's working for you and the person feels good, I'm not necessarily going to prescribe it, in New York, but if you're taking it and it's working for you, know the risks. But if it's working, I wouldn't say stop.
Okay.
Yeah.
And have you found that certain people have better ways of taking marijuana, whether it's smoking it, edibles, oil tinctures, vaporizers?
Yeah, I really haven't gotten into that aspect of it. I've heard everything that you just mentioned. I haven't really found one to be, on an anecdotal basis, one better than the other as far as delivery system. I would say just whatever the person has tried or whatever they're used to is usually what they stick with. Yeah.
How do you feel about naps during the day? Many people tell you that, or tell me that, they take these 2-hour naps during the daytime and then they can't sleep at night, or it
Right.
allows them to sustain the rest of their day.
Yeah. Yeah, it's a great question. I mean, I think that one of the biggest issues when it comes to sleep habits and sleep hygiene is, let's say somebody has and I should talk about this in my book, is let's say somebody has their dinner, they're watching TV, they're watching the news or whatever, and they just fall asleep, right? 10 minutes, 15 minutes or so, and you think, okay, that's an innocuous thing. What's the big deal? The problem, though, is that when we talk about getting to sleep at nighttime, we have to have what's called sleep pressure, and that's built up over the course of the day, right? One of my mentors in med school used to say you need a good 7 to have a good 17, right? You need a good 7 hours of sleep to have a good 17 hours of wake. So if you cut that off, right? So if you cut off the sleep pressure, even by a little bit, it's like kind of a gasket, letting out some of the air. What happens is 10, 15 minutes of sleep doesn't feel like it's a big deal. But at nighttime, 11 o'clock, 12 o'clock or so, when you're trying to fall asleep, your brain may be tricked and say, well, I already got some sleep. Some of that sleep pressure is been relieved. So therefore, I don't really have to get to sleep right now. And then what happens is, when the person can't fall asleep in that situation, they start getting frustrated, they start getting anxious, and then that kind of spins it out of control. So what I would say the biggest thing is, try not to doze after dinner. But naps can be helpful. If somebody didn't get enough sleep the night before, there's been a lot of data showing that it can reduce inflammation the next day. The problem with naps, though, is that it's kind of a slippery slope. So what I tell patients is, if you have to nap, if you have to, try to keep it early in the day as possible, like, before lunchtime even, and maybe 20 minutes or so. Anything longer than that, you're going to start getting into deep sleep, and then that whole sleep pressure thing I just talked about.
You probably just sleep cause long-term damage to the brain.
Yeah, so there was actually a couple of really interesting studies done in mice, which has been translated to humans recently, showing that during sleep, well, the brain, as you know, Roni, doesn't have really a lymphatic system the way that the other organs do. So getting rid of waste, as it were, byproducts of cellular life, can't really happen. But what they found was, in rats and mice, when they go into very, very deep sleep, okay, the supporting cells of the brain, believe it or not, are actually able to shrink down. And what that does, it allows all the, like, almost like convection. It allows the brain to kind of filter out and get rid of the waste products that have built up. So the theory is that when somebody is chronically sleep deprived, or not getting good quality sleep, that process is not able to take place, and those toxic byproducts are left behind, and that's what can lead to things like Alzheimer's and Parkinson's disease and things which we're starting to understand, but we don't understand fully.
You know, as a chronic pain specialist, 90% of my job is doing exactly what you're saying, you know, telling people how to live their lives better, you know, how to
Right.
exercise, how to eat better, and things like that.
Mhm.
It's actually an uphill slope because people prefer the easy way out.
That's right.
I'd say more than half of my patients are on some sort of sedative to help them sleep, whether it's
Mhm.
you know, benzodiazepine or something like that. Now, I'm going to
Right.
put you on the spot. If you had to choose, and someone's
Mhm.
saying, listen, I have this medical marijuana or I have 10 milligrams of Valium, which one should I use to sleep? What are you telling
Okay.
them as a sleep expert?
Yeah. So that's a great question. I would say, well, there are other options. Can we try something else? I mean, I'm assuming that let's say they tried everything else and nothing else has worked, and it's just between these two things. What I would say is, what else is going on, right? And the reason I say that is because if somebody has obstructive sleep apnea, right, where the airway is closing off throughout the night, having a medication like Valium on board can make that worse. You know, it's a muscle relaxant on top of its other effects. So if somebody had sleep apnea, you probably want to avoid that unless it's being treated. The other big question would be, is this a long-term thing, or is this just, you know, as needed, or what? So if somebody is like, you know, Sunday nights, for example, they get very anxious because they have to go to work or school or whatever, and the Valium one night a week works fine for them, I would say probably stick with that. If it's a more chronic situation, I don't know. You'd have to kind of you know, see what the risk benefit situation is. I know that sounds like a politician's answer, but that's the truth.
No, it's a good answer. It brings me to the fact that many people who smoke marijuana or take medical marijuana often get increased appetite. They get the munchies.
Right.
And that could be a problem when one of the main things we deal with in society is increased weight and obesity. And
Right.
actually,
That's
how
right.
does obesity affect sleep? And is that something that people who take marijuana should be concerned about?
Yeah, that's a great point. So sleep and weight have this interesting bidirectional relationship, meaning that when somebody doesn't sleep well, let's say it's from obstructive sleep apnea, what happens is these hormones called leptin and ghrelin. Leptin is made by our fat cells, and it tells us that we've had enough to eat. Ghrelin is made by our stomach, and that tells us that we're hungry. When we don't sleep well or sleep well enough, those hormones get out of whack. Okay, and we get leptin resistance, and our ghrelin goes up. So what that causes, that flips the balance, and it makes us more hungry and you know, not as full as quickly. That process then leads to weight gain, right? When weight gain happens, then there's a higher risk for things like obstructive sleep apnea, and it becomes this vicious cycle. So what I would say is, you got to be careful about weight for sleep apnea itself, but also this whole notion of how we sleep chronically also plays a role in how much we weigh and how our body is able to metabolize food.
Medical marijuana is kind of becoming a more integral part of training as doctors in part of our treatment care. You know, more and more states have either recreational legalized or medically legal. Um, we actually don't know so much about how it affects sleep in the long term. And that's very problematic when you have more and more patients coming to you and asking you about it. How do you
That's
think
right.
we can fix that? What do you think we can do to learn more about it? What kind of studies can
Yeah.
we do?
Well, I think what has to happen, I mean, what has to happen is there's got to be controlled studies. Okay, so either from a government agency or from a university or a combination, we have to produce probably a high quality strain of whatever it is that we're going to study compared to a placebo, and just do like we do with a medication, and see over time, you know, 3 months, 6 months, 9 months, a year out, what's happening electrographically when these people sleep. So have them come in for a sleep test, serial sleep tests, and measure both subjectively how they're feeling, how they're sleeping, but also objectively what's happening to the sleep stages. Like we said, is there REM suppressant? Is there other factors that go into this? And from there, then we can definitively say, at least over a year's time or so, that yes, it's safe, or no, it's not. That's the only way.
Yeah.
Yeah.
And we know that medical marijuana or marijuana in general can affect memory.
That's right.
Is sleep a big process that we have that consolidates memory, and can marijuana actually affect that in a negative way?
Yeah, that's a great question. I honestly don't know the answer to that. I mean, we said, we know that lack of sleep affects memory. Marijuana can affect memory, right? But what if somebody's using marijuana to get better sleep? Where does that play into it? And this kind of comes into that big question we keep asking. Is it better to not sleep or to sleep with something that's potentially harmful? Nobody knows. Nobody knows the answer to that. I would always say this, though. This is what I tell my patients too: is it's always better to sleep. I think sleep is very restorative. I think it's something we can do to help our health in all ways. So I think it's always better to sleep.
Yeah, one of the pathways that I always try to treat patients with is improving their sleep. Without improved sleep, will never make progress in their pain or anything like that. For some people, marijuana can be a tool, but I think that there's a lot of question marks, and I think there's a lot of risks involved in that as well. Let's talk about sleep. This book that you put out, it could really be a big tool for people. Getting to the nitty and gritty of actually organizing your sleep schedule, improving your life. Not only improves sleep, but it also improves how they're doing when they're awake. No.
That's right. Yeah, like you said, Roni. I mean, you're a pain specialist. Our fields are very, very closely related as neurologists. And what I'll tell patients is I'll see people with chronic pains myself, and I won't necessarily treat them for that. But what I'll say is, if you sleep better, you may find you're able to deal with the pain a little bit better on the next day, or it may not be as severe, and that usually entices them to kind of follow along the recommendations. So that's helpful.
Listen, Dr. Barone, this has been awesome. We really appreciate you coming on with us today. Thank you very much.
Thank you for having me. Thank you for having me.
All right, bye, everyone. Come on to the Cannigma if you want to learn more about medical marijuana and a condition that you may have, whether it can be helpful, harmful, side effects, everything's there. Thank you, everybody. Have a good night.
Thank you.